Please don't forget to subscribe our channel. Hey, we are now presenting how to diagnose vaginal discharge. Number 1. Understand the function of vaginal discharge. The vagina has a specialized lining, which contains glands that see if you are experiencing or have recently experienced any of the following conditions. These are the most common, but completely normal, reasons your discharge may change. Number 4. Don't worry about cleaning out your normal discharge. Your discharge is your body's natural way of protecting itself. Douching is advisable only on rare occasions. If you don't like the feeling of wetness on your underwear and clothing, consider wearing a panty liner in your underwear. These can be purchased at grocery stores, drug stores, and pharmacies, and convenience stores. You can also make your own panty liners out of fabrics you have around the house, or bought from a craft store, if you want a cheaper and more natural solution. Number 5. Examine the color and texture of your vaginal discharge. If it looks different from the vaginal discharge you usually secrete, then there is a chance that it is abnormal and a symptom of an infection or change in the vaginal environment. A good rule of thumb is that if the discharge isn't clear or white, then you may have a problem. Number 6. Evaluate the vaginal discharge. Having examined the discharge, now assess which of the conditions that can cause abnormal discharge may apply to you. If your discharge does not fall in the normal range of colors and textures, it may be a result of one of the following. Bacterial vaginosis. This is the most common cause of abnormal discharge in women of childbearing age. Bacterial vaginosis is a mild vaginal infection caused by bad bacteria. Essentially, there are good and bad types of bacteria, and the good types help to regulate the growth of the bad types. Number 7. Consider other causes of abnormal discharge. There are a lot of things that can affect the vaginal environment. Exposing the vagina to a new type of cleaning agent or hygiene product can have an effect on it. Chemicals found in detergents and fabric softeners, feminine sprays, creams, douches, and contraceptive foams or jellies or creams may irritate the vagina and / or the skin around the vagina. Medications, such as antibiotics, can also increase the possibility of infection. Number 8. Consult your physician. If after self-examination, you believe your discharge is abnormal, visit your doctor. Though it's useful to pay attention to your body and its many changes, don't rely on your own diagnosis as confirmation of particular condition. Let your healthcare provider examine you, run any necessary tests, and decide on a course of action or treatment. Number 9. Make an appointment with your physician. You should try to see your doctor as soon as you notice or suspect that your vaginal discharge is abnormal. Be prepared to describe the color, consistency, and frequency of the discharge. Number 10. Let the doctor know of any conditions or actions that may be relevant. For example, if you think you may be pregnant or recently had unprotected sex, i.e., sex without a condom, you should let your doctor know. Number 11. Have a physical examination, including a pelvic exam. 20. Depending on your symptoms, your doctor may elect to do a partial pelvic exam or a full exam. A full exam includes an external and internal examination of the female pelvic organs. The external exam, your healthcare provider will examine the opening of your vagina and the folds of your vulva. In particular, your doctor is looking for abnormal discharge, cysts, genital warts, irritation, or other conditions. Number 12. Have your samples sent to a lab for testing. After the exam, your doctor will send all cultures and samples to the laboratory for testing. The most important test for samples of vaginal discharge is microscopic examination, or a wet prep test. In a wet prep test, a technician will mix the sample of vaginal discharge with saline and take a drop of this mixture and put it on a slide to examine. This is usually done in the doctor's office, so results are available immediately. Number 13. Wait for your test results. Make sure to find out when you should expect results from these tests so you can meet again with your doctor to develop a treatment plan if needed. Thanks for watching. Please like and share this video. Don't forget to subscribe our channel. Swelling, bruising, limited mobility and a popping sound when the injury occurred. The sprain is temporary and tissues are not permanently damaged. Sprains usually improve in just a few days. Number 2. Determine if you have tennis elbow or golfer's elbow. These conditions, also known as tendinitis, lead to pain in the elbow area of the arm. Causes usually include overuse of the muscles and tendons around the elbow joint. Pain can last several weeks or even months, but taking care of the injured arm will help it heal faster. Number 3. Check for symptoms of bursitis. Bursitis is inflammation of the bursa, which are small pouches of fluid that sit over joints to protect them. Normally the amount of fluid in the bursa is very small, but with injury it can swell up and become very painful, causing bursitis. It usually develops from repetitive movements of the arm, and the pain often improves in a few weeks. Swelling can last longer but will gradually get better as well. Number 4. Consider nerve pain as the cause. The nerves in the spinal cord can become compressed, especially as you age. Symptoms include radiating pain from the neck to the arms or a feeling of pins and needles. Pain can fluctuate from day to day but usually improves with non-prescription painkillers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and exercise. Number 5. Know that a repetitive strain injury, RSI, is a possibility. When you use your arm or hands to do tasks regularly, such as at manufacturing, manual handling, heavy machinery, and computer jobs, RSI can occur. Carpal tunnel syndrome is one type of nerve injury that can result from repetitive motion like typing. Employers can improve conditions and modify your workspace to help prevent aggravating your condition by, for example, offering an adjustable chair or moving your work platform so that you don't have to reach up as high. Number 6. Check for symptoms of angina. Angina results when arteries that lead to the heart become hardened and narrowed. Symptoms include dull, tight, or heavy-feeling chest pain that can radiate to the left arm, neck, jaw or into the back for several minutes. The pain usually shows up during activity or stress. Always see your doctor if you have chest or left arm pain related to exercise. Women in particular more commonly present with less classic symptoms of angina, such as arm pain only. Number 7. Rest the sore area. Don't exercise, lift, type or do anything to make the sore arm feel worse. Your tissues need to relax in order to heal and prevent further injury. Discontinue all activities that make the pain worse, and focus on using the injured arm as little as possible. Number 8. Use wraps or compressive elastic bandages. To decrease swelling and help protect your arm, you can wrap the area with an elastic bandage, such as an ACE wrap. Be careful not to wrap your arm too tightly to avoid swelling around the wrapped area. Always loosen bandages that become too tight. Number 9. Remove all jewelry. Your arm, hand, and fingers can swell a lot after an injury. Be sure to take off rings, bracelets, watches and all other jewelry. They can be harder and more painful to remove later as swelling increases and can contribute to nerve compression or restricted blood flow. Number 10. Wear a sling. Slings can help keep your arm elevated and protected. They can also keep pressure off the injury, make you more comfortable and offer support. Contact a medical provider if you need to use the sling for more than 48 hours. Number 11. Elevate your arm. Keep your arm above or at heart level to reduce swelling. When lying or sitting down, you can use pillows on your chest or side to keep your arm elevated. Don't make your arm so elevated that you don't get adequate blood supply. Number 12. Apply a cold pack. You will want to use ice or cold packs as soon as possible to help keep swelling at bay. There are many cold therapy packs available from your local drugstore that you can apply to the sore area. You can also use a bag of frozen vegetables or a towel filled with ice. Cold can be applied for up to 20 minutes several times a day. Number 13. Use heat. When 48 to 72 hours have passed after the injury, you can apply heat to the sore area. Don't use heat if you still have swelling. You can also alternate between heat and cold to help make your arm feel better. 4. Avoid heat on the area for the first 48 hours because it can increase swelling. This includes hot showers, tubs, and packs. Number 14. Take NSAIDs. Over-the-counter painkillers like ibuprofen, naproxen, and acetaminophen can be used to help with pain and swelling. Always follow the directions on the label and don't take more than the recommended dose. Never give children aspirin. Number 15. Massage the area. You can use gentle pressure to rub or massage the sore area. This can help with pain and get blood flowing better to repair the damaged tissue faster. If it hurts too much, don't try to massage it until your pain level decreases. Number 16. See a doctor. Always consult with a doctor for any questions or concerns you may have regarding your sore arm. If you are unable to control the pain, it lasts more than 2 weeks or your pain gets worse, then you need to see a doctor. Also, if you can't use your arm normally, you develop a fever or you start to get numbness and tingling, it's time to call your medical provider. Number 17. Listen to your body. Don't force your arm to move a certain way or pick something up if it hurts. Pain lets you know you need time to recover. If your arm is sore, then let it rest and repair any damaged tissues. Don't push yourself to do things that may make the injury worse. Number 18. Drink water. Sometimes dehydration can cause muscle cramps that can be felt in your arms. Always drink extra water when you're exercising or out in the heat. Electrolyte replacement drinks or sports drinks can be diluted with water to about 1/2 and 1/2 and used to replace salt, sugar as well as other minerals. Avoid caffeine and alcohol. Number 19. Eat well. You need to eat a balanced diet to ensure that you get all your daily required vitamins and minerals. A lack of some minerals like calcium and magnesium can cause muscle cramps. If you feel like you aren't getting what you need from what you eat, consider a whole food-based multivitamin or talk to your doctor about taking more calcium or magnesium. Number 20. Reduce stress. Stress lowers your immune system and makes it harder for your body to repair itself. When you are injured, it's important that your body can focus on repairing the damaged tissue instead of trying to regulate a stressed system. Practice meditation and deep breathing exercises to encourage healing. Number 21. Learn proper form and movement. When you do certain activities, you need to use the proper positions and movements to avoid straining muscles, joints, or tendons. If you make the same arm movements often throughout the day, then you should consider finding other ways to move your arms to avoid RSI. It is sometimes necessary to have a professional evaluate your arm movements at work or while performing other actions to ensure they aren't problematic. Number 22. Don't smoke. Smoking can slow healing. It can decrease